So due to some comments, I think we have to make one more video today on thoracic extension. I didn't really want to do that right now because I'm fat, but fuck it. Let's make the thoracic extension video. The first most common misconception when it comes to thoracic extension is where the extension should come from. Well, how much as well, you could say, but especially where should it come from? It should come from your upper back predominantly. This is a little bit of a complicated topic, but let's try to get there, all right? You see, what most people do is that they have their pelvises forward and they lean back on the thoracolumbar junction or the middle back / lower upper back or whatever you want to call it. When they lean back on that, the shoulders and the neck comes forward to maintain an efficient center of gravity. If I stay here, I'm going to be falling back and it's not efficient for the body. Let's get that camera a little bit up. There, baby. Now, how do you work? So first and foremost, how do you work on thoracic extension? Your goal is to get it to work up here. The erector spinae muscles. I will put a photo there. Because you do not want to just pull your shoulders back. This is what a lot of people do. They already stand like this and they can see it doesn't look good and they do this. They pull their shoulders and their neck back like this. So basically hyperextending the neck, ramming the shoulders back, and the upper back is still here. It just looks better. It's an illusion. It looks better, but it's not better. Because you don't want to pull your shoulders back, you want to actually extend the upper spine. Now, what I typically aim for, I aim for the chest over the pelvis, not behind, not in front, not behind. And I aim for the nipples pointing approximately forward, not up, not down. Up would then typically be excessive. Now I can achieve up as well if I simply lean back like this. Although my chest is still pointing down. Do you see that, guys? My chest right now is pointing down, but I'm leaning back, changing the platform. Does that make sense? So you first want to get a gross alignment. And then, if the chest is still pointing slightly down, you pull your nipples gently up and forward. Now, there was a comment that said that when you do this, it will increase thoracolumbar junction extension. That's absolutely not true. When I lean back, that will increase thoracolumbar junction extension, and it will perpetuate the kyphotic, the kyphotic thoracic posture. But when I pull up and forward, it will elongate the thoracolumbar junction, which is what you want, and it will cause pure extension of the upper back, and that's what you want, in my opinion, okay? The way that you practice this is not so much going from gray to white, or from, let's see, from, yeah, that's the best explanation, I think. Because if you go from your thriving zone where you're comfortable, it's very hard to find the right place. So I like to go from black to white. Like to go from the obviously bad to the obviously good. So I like to really fall into a terrible posture. You see how my nipples are coming down, but I'm leaning back on the thoracolumbar junction. And from this position, I pull this way. You see that, guys? That's how you correct it. Now, this can be very, very difficult for the patient. In cases where it's difficult, I take the cheat away from them. When it's difficult, I take the cheat away from them by having them sit down. There. Now they can't cheat anymore with that hinge sway back position. So I sit them down and I have them lean into it. You see my nipples are coming down and my chest is and back is driving backwards. And then I do the opposite. You see that, guys? You might have to do this a little bit before you get it right. And I'm not just pulling my shoulders back. Do you see that? I'm using the erector spinae muscles to pull the nipples up and forward and elongate that middle back, all right? Now, there was another comment that said, when I try to get my chest up, my arms and my pinkies go numb. I didn't really want to get into this, but let's talk a little bit about it. Thoracic outlet syndrome, guys, I feel that I'm on repeat mode here, but it's such a common problem. And mild symptoms, we're not talking full-blown TOS, but mild symptoms of TOS are very common. They're very, very common. So when the patient says, you know, especially ulnar nerve symptoms, guys, extremely common in TOS. So when the patient says that they put their chest up and try to improve their chest posture, and then these ulnar symptoms come, or it could also be chest pain, it could be, you know, I had another guy there comment about costochondritis. It's usually not costochondritis, it's usually TOS symptom, a nerve pain related symptom. Arm pain, shoulder pain, that's shoulder blade, etc. All right, these symptoms. When you get that after you try to amend your chest posture, the most common reason for that is you put your chest up, right or wrong, right or wrong. As you put your chest up, that first rib will come up. That's normal. If you accommodate that, well, if you do not, if you fail to accommodate that, and you either pull your chest back, your shoulders back, which will decrease that costoclavicular space, that space between the brachial plexus, the nerve bundle, your collarbone and your first rib, you will impinge the nerves. And depending on your degree of vulnerability, you may or may not get brachial plexus symptoms. Another mistake is simply leaving the shoulders where they are, down. Most people, almost everyone, have their shoulders down, which I discourage. See my other videos. And then they put their chest up. And that space was narrow to begin with, and now you put that first rib up, which of course will inevitably happen when you get into the proper chest position. And that will decrease the space. So if you change your thoracic positioning, which it's not the most important thing you can do in my opinion, but it's something it's generally good for your health, your thoracic spine and your neck posture, then make sure that you accommodate that by pulling the shoulders gently up so that you make a slight space for the nerves. Because if you just put your shoulder blade up, well, no, if you just put your chest up, if you increase that thoracic extension, that first rib will come up. And if the shoulder blade stays where it was, you will decrease that space, all right? I hope that makes sense. Again, we're not talking about full-blown dangerous TOS here. These are mild, subtle symptoms that can, and from there and up, obviously, depending on the case, that can come with these patients as they're looking for partial corrections. It might be that they had no issues before, they implement these correctives and get worse, or it might be that they already had symptoms and they implement this and get way worse, all right? So, let me quickly also talk about neck extension. I didn't touch on this. Well, I mentioned it briefly in the other video, but what a lot of people do is that they puff the chest up like this, pull the shoulders back, and then pull the neck back. If you look here, guys, you look at the angle, the orientation of the ribs here, contrary to what you would typically imagine, is that as I pull the shoulder blade forward, the clavicle forward, I will increase that space to the first rib. You see that? And as I pull the shoulder blade back, even if I stay at the same height, due to the orientation of the ribs, I will decrease that space between the collarbone and the nerves. So pulling the shoulders back is generally bad. There are some other caveats there as well and some other nuances, especially the pec minor tensioning that comes from that. Some people have it, some people not, predisposed at least. And then the second thing, when it comes to the neck positioning, there's so many patients that call me due to this. They feel bad, they go online, look for answers, start pulling their chest up, shoulders back, neck back to improve their postures, and they get way worse and they give up. When you pull your neck back, you hyperextend the neck. That's bad for you for all kinds of reasons that I already talked about. The other thing that happens when you extend your neck, if you already have very tight scalenes, this might cause nothing for some, it will cause a big problem for others. If you have very tight scalenes and you pull your neck back, it will pull the first rib up. This is palpable. You can put your finger down. Let's see if you can see that. Put your finger down here and pull your neck back, and you will feel that entire rib come up. all right? This is not a myth. This is real. So if you increase extension of the neck more than you should and you stay there and you on top of that keep your shoulders down or down and back, that will crush the brachial plexus. Like I said, oh, but I have a body that does this and he's fine. Yeah, some people are more and some people are less vulnerable to this. So in general, I recommend not doing that, but especially if you have a predisposition. Okay, I hope I made that clear. So, how do we address the general posture then? You try, like in a summary here, you try to align the pelvis with you grossly align the pelvis with your chest. You try to have the center of gravity approximately midfoot, okay? You don't clench your abdomen, you don't clench your quads, you don't clench your butt. A lot of people, it's another thing, a lot of people, when they try to get their chest up and they reflexively clench the abs. And of course, then you're never going to be able to get out of that position. So the abs stay fairly relaxed. See my other videos on this. And you pull the nipples gently up and forward. And as you can see, as you might be able to see here, guys, if I do this, if I lean back, I get a lot of that TLJ extension. But if I pull this way, I do not. Do you see that? I get that lengthening. Because it's true, if you hinge on the TLJ, you will get mid-back symptoms more likely. That is true. And it also increases the risk of spondylolisthesis. So, did I cover everything? I don't even know. This is the third video. That's how you change the thoracic posture. That's how you first get the gross alignment decent. It doesn't have to be perfect. Get it decent. Don't clench. Get your nipples gently up. They should point straight forward or slightly below. They should not point down nor up. All right, so that would be excessive or inadequate. Remember that you can fake the nipple trajectory orientation by merely leaning your back backwards, and that's not what you're looking for. And also, like I said, if you opt for thoracic extension, which certainly looks better, but comes with a couple of pitfalls. Because if you leave your shoulders down and you do this, it might cause brachial plexus symptoms for you. I'm not saying it's super dangerous, but it's certainly something that it's feasible to avoid, right? Okay, let's see how this turned out. Once again, wish you all a great weekend. If you have any questions, you leave them down below. And the best to your health.